Many thanks for joining the viewers. You are watching OBN Horn of Africa. This is our weekly program, Diplomacy, and I'm Fantambalete hosting this program. Today, I'm joined by Muluselam Akililu, healthcare administrator in Minnesota. Till the end of our program, stay with us. Muluselam, thank you for joining me and welcome to this program.
Thank you for having me.
Great. Today, we're going to discuss your life journey and your profession. To begin with, could you share us a bit about your background and what inspired you to become a nurse?
Well, I grew up in Ethiopia, like in a very like a small town, and I've seen a lot of healthcare issues when I was back there. That kind of drew me to more focus on healthcare areas. And when I came here, there's an opportunity to peak and go for what you are pursuing. So when I was back home in Ethiopia, my field was totally different. I actually studied accounting and finance, um, which I thought would be a better idea, but coming here changed that perception because um, healthcare is the most important and satisfying and kind of like give you a purpose on what you do. So that's why I kind of decided to go for nursing at first, and then I kind of build up on that, becoming an administrator.
Thank you very much, Mulusalam. What was your journey like moving from Ethiopia to Minnesota?
Well, it's at first kind of a dream come true because I'm going from where I thought would be going to a land of opportunities, and there isn't a lot of expectation when you come to this country. Um, it wasn't easy. There are a lot of challenging things, culturally, um, the way everything runs here, healthcare, work ethics, um, financially, and it's been a very challenging process. But luckily, I have a lot of friends. That's families here that were very supportive, and it kind of gave me um, the chance to go for what I envisioned to gain um, from this, like moving from Ethiopia to this country. So it's not an easy a journey, but I think it gave me a chance to grow both personally and professionally.
Great. What are your memorable experiences in nursing?
Were a lot of things, and like working as a nurse, most days are very challenging, and you make a connection with your patients. You make a connection with them, their family, and you go through all their ups and downs with them. And every day, you, I see people being happy, being recovered, and because they come to us to get some help, and it's very satisfying when you see them um, uh, become uh, healthy again and feel well, and you kind of get a relief with that.
What is the best part of being a nurse abroad?
In Ethiopia, as a patient, I went to different clinic, either with my family or by myself. And one thing is lack of equipment. Like we don't have that advanced kind of thing is that we use here. Um, Being a nurse here gives you an advantage to get more in-depth understanding of how to treat patients with respect and dignity. We have the material to help them with what their needs are. Back home, we have, in my understanding, I know there are a lot of changes right now, and they're working on education, and but one challenging part in back home is the way they treat the patient, and patient needs to be treated with respect and dignity. I've seen a lot of changes, a lot of improvement, and especially in main private and public hospitals back home in Ethiopia, but we still need to work on that area, how we treat patients, beside not having proper equipment to treat them. So being a nurse here has a lot of advantage. I have an opportunity to work with um, most specialists and with different equipments and on different departments on different let's say chronic and acute care centers. So I think it's kind of rewarding to be a nurse.
How does practicing nursing in Minnesota differ from the experiences in Ethiopia that you have?
My experience in Ethiopia is totally different from Minnesota. But nursing from like as a patient or going to the clinic with my family back home in Ethiopia, nurses, I think, uh, don't do much except like checking vital signs, and I don't see a lot of work from the nursing side, and I see doctors do most of the work when I go to the clinic in Ethiopia. Here, nurses are the main um, caretakers here, and the doctors come to you. They ask your advice because we know better um, about the patient than the doctor. So they come to ask us like, what do you think and how the things are going? So we give them more information because we have more information than the doctors. They will come only for few minutes, and they usually do um, their assessments, but we do most of the assessment part and most of the treatment part too. And here the doctors usually give you orders to do those things. And back in Ethiopia, it's mostly the doctor's job to treat the patient, and there's not a lot for the nurses to do.
Thank you. Where did you study nursing? Is it in Ethiopia or there?
Well, I studied nursing here in US. Um, it's a very rigorous process. They're very serious, and the regulation is very serious here. So that's why they put you through a lot of ups and downs, and it's a very rigorous process to go to nursing in US. Um, yeah, one thing that's what makes different for healthcare from Ethiopia is the regulations, and I don't think Ethiopia's regulations are not as strict as US because I know there are things that needs to be considered uh, given the country's status, but still healthcare needs to be very well regulated back home as well to protect the patient.
Great. Have you faced any cultural or professional challenges there?
Of course, culturally and back in Ethiopia, the way we show affection or caring is by getting close to each other and touching and hugging. And but here you have to give them the space. And uh, the way when we treat people, the way we approach is being polite is a good thing, but the way you show them, the way we show them like culturally is kind of like they feel like you are not confident enough. So you have to be firm when you talk to them, and respectfully, of course. Um, yeah, it's a lot of challenges, and all color has some effect on how we approach people, and our accent has an effect on us, and being an immigrant has an effect on us. It's not an easy process.
What are some of the most rewarding aspects of being a nurse abroad?
We get more advanced um, training. You get a lot of skills. We get a chance to work with patient from with a lot of cases, chronic and acute illnesses, like I said. And we have an opportunity to work with more advanced technologies. And there is also a rigorous training that you go through to improve your skills. And there we have um, refresher training. Even if you're at work, we have to go training a few times a year, and some quarterly, annually, and semi-annually. So it's it's very rewarding. It keeps you up to date. It keeps you more engaged in what you do.
In what ways do you and your institution support Ethiopia's healthcare initiatives or institutions?
In the future, I'm planning to at least uh, participate in mentoring people back home. Um, if thing is um, get a line for me, I have planned to at least start some kind of healthcare there. It could be um, for disabled and long-term care people, for elderlies and orphans and stuff like that. And I'm in a process and kind of like I have that goal in the future, but for now, my institution in particular is not directly participating like in healthcare initiative in Ethiopia, because I recently started my working at this place, but my previous place is a well-known university here. They do a lot of researches. They do give educational opportunities for Ethiopians, and I know a lot of people coming to the university and studied in healthcare, doctors, pharmacists, and a lot of people I know. So maybe in the future, if things get in line, and I have planned to more engaged in healthcare initiative in Ethiopia, as well as could be in terms of teaching or mentoring, or when things align, maybe opening something tangible.
When you were in Ethiopia, what challenges or what problems did you observe in healthcare institutions in Ethiopia? And what do you think are possible solutions to improve the services they give to the citizen of the country?
Well, for me, it's as simple as like let's say here, if you wanted to see a doctor or a clinic or a hospital, you need to make an appointment in advance. Let's say now before I meet you, I would say like I'll meet you at 11 p.m. Saturday. That is my appointment, you know. So in Ethiopia, it's first come and first serve. So I can see a lot of people sitting there waiting for their time to be seen, and it kind of opens for unfair treatment for patients, because if they saw someone they know, they'll call them first. But that there are people who are sitting there the whole day, entire day, and sometimes go home without even being seen. So they can at least fix this. This is it doesn't cost them any penny, This is just treating people fairly or to be fair to everybody. And that's one thing. The other thing is something that doesn't cost them anything is to treat people with respect and dignity. And they come to the clinic to get help. They're very vulnerable. They need treatment. They're sick, and we need to treat them with dignity, like as if we wanted to be treated, right? And those are the things that I think is helpful for the Ethiopian providers. And one thing from overall is there should be accountability. Like if you mistreat people, they need to be accountable for it, and there should be some kind of um, like consequences for not uh, providing or carrying out their responsibility because the care provider, they're trained to help people. If we choose to go to this field, we are responsible to provide what we're supposed to do or provide to our patients. So there should be some kind of accountability.
Could you discuss any specific programs or partnerships that you are involved with in that aims to boost healthcare services in Ethiopia, please?
I have in a plan and kind of like so far I was in a kind of like busy life, so I have a plan to start some kind of initiative by myself, and I have friends that works in healthcare and that I can organize. And but I do know in my community we have a large community here in Minnesota, from churches and civil community, civil service people, communities that um, based on like it could be from regions where you came from, but everybody they're kind of coming together and doing thing is like sending educational material to students back home, sending healthcare materials to people, healthcare in Ethiopia. Like when the COVID came, a lot of people, our community send stuff to Ethiopia. So uh, the community is working. They're working. We always think something when we see something new, something very it could be um any kind of technology. Our community, we always think about our people back home, and everybody tries to do their best. And I think if things allow, like if there are challenging things that kind of hinders people not to do what they're doing, but if things are like get in line, I think a lot of people are open to help healthcare initiative in Ethiopia.
How do you believe your work in Minnesota impacts healthcare landscape back home?
Well, it can change in many ways. Um, I mentioned earlier, so we can change the culture. How do we provide uh, healthcare to our people back in Ethiopia? Uh, we can help them increase their skills through mentoring or participating in educational institutes. We can help them like making a connection with providers and hospitals or clinics here so they can share experiences. There are a lot of things that we as a diaspora can do as well as that providers in Ethiopia. I'm pretty sure they're will be open to participate in things like that because it will open an opportunity for them as well. And yeah, it's a lot of ways we can change the landscape, like the healthcare system in Ethiopia.
All right, you have raised the role of diaspora. What do you think
Mm.
the Ethiopian diaspora should play in supporting health and education initiatives in Ethiopia?
A lot of people are still helping, so I like to give them a credit. And some people individually, they're helping uh, some orphans or whatever they can, and some are helping through their churches, and some are through their communities, like Oromo community. We have people collect books and other materials and sending back home, and same with healthcare equipment as well. So I think the diaspora is still working, but I think we need some kind of like people that can bring us together. So if we work together, and I think we can do more, because I know a lot of people are doing by their own, but it's better if everybody comes together um, and work together, then we can contribute more to elevate the healthcare system in Ethiopia.
How do you connect with the Ethiopian community there in Minnesota?
So, Ethiopian community, for example, at my church, we provide healthcare education, how they take care of themselves. Um, we provide some small tests like checking their blood sugar, blood pressure, and stuff like that, and how they treat themselves. And we do vaccines, for example, flu vaccine, COVID vaccine at our church. So same with like other places. And if we go, and I'm just talking in particular my church, but other churches do the same thing. Other community gathering, they do the same thing too, to teach their communities um, about healthcare, how they take care of their body, and also providing vaccines as needed.
What do you recommend the diaspora to better support healthcare development in Ethiopia?
I worked as a nurse for many years. Then I went into um, improve my skills. I just wanted to go a little bit, and then I went for healthcare administration, and I did my BSN and master's on that. So it's most of the healthcare is system improvement is on administration part and our policies. So to say at least what I've observed, and I don't see um, a strict policy or a policy that goes down to the people who provide direct care. I don't see that back in Ethiopia. So there is some lack of accountabilities when they on the way they treat their patient. So our country needs to work on that, and the healthcare provider overall needs to like be patient-centered. If we're treating patient, um, we have to listen to what patient has to say. There are things that doesn't need any kind of monetary investment, but changing the culture and enforcing some accountabilities, and things like that is that I think would be more beneficial, like coming from the administration part, like how do we administer the care what that we are supposed to, um, and feeling accountable and being responsible for our patient.
What are your future nursing goals?
Well, like I said, I'm not in nursing, doing nursing right now. It's been a while. I'm more focused on administration part. So I don't see any future in nursing, in short. So my goal right now is more of uh, changing like making an impact on how the clinic runs and how the hospital runs, and it's a lot of
Healthcare
things.
situation.
It's overall operation. It could be nursing, doctors, other assistant like staff, like human resources, and all inclusive. So my role right now is more broad than just nursing.
So what is your
Yeah.
future plan?
My future plan is I always dream going back home, and I'm hoping that will happen someday. So if that happens, and my um, goal will be either going back home and teaching in on campuses, or opening my own um, healthcare facilities back home and work on that area.
Thank you. Finally, what is your vision for Ethiopia's healthcare future?
My vision is I wanted to see Ethiopian healthcare uh, system to be more inclusive. I wanted to see more where people treated with respect, like patients specifically treated with respect and dignity, um, where there is a fair treatment, and where I just wanted to see where there is an accountability and responsibility for the healthcare providers, as well as where the healthcare providers treated well, because healthcare is they pay you more than anywhere else in healthcare here. So, and I wanted to see them to get what they deserve, because it's a very challenging, it's very exhausting field, and they need to be rewarded for what they do.
Thank you very much. If you have any concluding remark or message, you are welcome.
I hope one day, and if things are come in line, both in many ways, I will love to go back and contribute my part.
Anything you want to say to the people who might have helped you in your life?
Well, just a lot of people. Um, Growing up, and I have a lot of friends and people who I grew up with, including you, and my our neighbors. And it's hard to mention people's by name. And my families, they all helped me and contribute in some way, to get for me to get to this position right now. And after I came here, there are a lot of people who helped me while I'm going through school and through a lot of challenges. And I'm fortunate enough for having those people around me, and I still have their support. And I cannot like thank you them enough. So hopefully I'll make them proud someday.
Muluselam Akililu, healthcare administrator in Minnesota, thank you for your precious time and insights. We had an interesting interview today. Thank you very much for your time and insights as well again.
Thank you very much.
You're welcome. Dear
Bye.
viewers, this brings us to the end. Thank you for watching and stay connected with other programs of OBN Horn of Africa.